Thanks for staying with us this afternoon. MPS students are back in class today, and masks are optional as Milwaukee County is in the medium transmission category for COVID-19. So joining us now live is Dr. Jeff Pothof from UW Health. Dr. Pothof, it's good to see you as always. There are a couple of things that I want to touch on with the pandemic this afternoon, but of course I want to start with schools here. Of course, obviously a really big day today as the students did head back to the class. So where do things stand right now, and do parents need to be concerned about coronavirus when they are sending their kids to school every day now?
Yeah, I think, concern is probably too strong of a word, but we as parents sending our kids to school, should be aware that the virus is still out there and things we need to do to keep our kids safe. I think the two big things for schools right now are one, if your child is vaccinated, that's great. If they're not, we know that their risk of severe disease or long haul symptoms is higher. It'd be nice to drop that risk for those kids, so get those kids vaccinated. Secondarily, and this one's really important because we cheated on this before the pandemic, if our kids are sick, don't send them to school. The last thing that we need are kids who come down with COVID in the classroom unmasked, making other kids and teachers sick. So if kids are sick, don't send them to school this year.
And maybe instead of concern, maybe aware is probably a better word than with that being said. And while COVID may be on the top of minds for many parents, there's still flu, RSV, and other viruses to think about. So what do parents need to know about those as kids are back in the classroom now?
Yeah, I think it'll be a throwback to, times before the pandemic. We've only been talking about COVID, it seems like, for a couple of years, although we do have these other respiratory viruses that are out there. RSV in particular, for those very young kids, can be a bit of a challenge. So certainly if your child has increased work of breathing or things like that, get them seen by their medical professional. But for other kind of respiratory illnesses, it's the same thing. Good hand hygiene, washing your hands frequently, keeping sick kids out of school. These are all ways that we can decrease transmission of these other viruses, which may be not as dangerous as COVID-19, still cause some trouble for our kids.
And I want to touch on the Omicron specific booster shots. The CDC recommended teens and adults to get the updated boosters from Pfizer and Moderna. So who should get these new shots and when?
In simple terms, anyone who is age 12 or older, where it's been at least 2 months since your previous COVID booster, can get the updated vaccine, and I imagine they'll become available probably later this week. I would guess that your national pharmacy chains like CVS, Walgreens are going to have doses ready to give probably by Thursday or Friday, and then the rest of the vaccinators in the state that get their supply allocated from DHS will likely be vaccinating by early next week. So certainly by next week, if you fit that mold, you'd be able to get yourself updated with these new bivalent boosters.
Yeah, and news we are following. Dr. Jeff Pothof from UW Health. As always, we appreciate your time and your insight.
Thank you.
Have a great day. Well, a reminder, you can always find the latest information on the COVID-19 pandemic on our website, tmj4.com/coronavirus.